everyone. Our third specialty talk of the day will be given by Dr. Hamad Aldraye. Dr. Hamad is a R4 Chief Neurology Resident at King Faisal Specialist Hospital and Research Center. Doctor, thank you so much for agreeing to give this talk. You can start whenever you're ready.
Assalamu alaikum, everyone. Is my voice clear?
Yes, Doctor. Walaikum assalam.
Okay, Assalamu alaikum, everyone. My name is Hamad Aldraye. Just a correction, I am the Chief Resident of Quality, which means I just relate to the quality parameters that the trainees need to work on rather than be the Chief Resident for the training program. I know that's an important differentiation for some people who would like to be part of the program in the future, but I'm always ready to help. So my name is Hamad Aldraye. I am a proud Alfaisal graduate. I graduated around 2017 and currently, I'm in my fourth year of neurology here in King Faisal Specialist Hospital. I'd like to thank the team in Alfaisal MedHub. They've been doing amazing work. I've previously been the MSA president in Alfaisal University. And honestly speaking, what I see the work here in Alfaisal MedHub is honestly substantial. It's very important. It's very targeted and specific. And I'm sure any student who would go through the pathway of Alfaisal MedHub would benefit drastically when it comes to actually going into the clinical and research-oriented work of residency and actually becoming a physician. So I just applaud you on that. So without further ado, I'll be talking about neurology residency. I'll be talking about the things I think are most important. So whenever you are ready to ask a question, you can leave it on the chat or you can ping the moderators to discuss further. So first question is always why? Why would I want to be a neurologist? Why do I want to choose neurology as a specialty? And why do I want to pursue this as a career? So when it comes to the brain is such a delicate, elegant, and detailed structure. Here is a beautiful image about the corpus callosum, which is the piece of tissue that connects the left brain to the right brain. And I first started loving neurosciences and neurology when I was a young child, looking over some interesting people in history. And I noticed that Albert Einstein was a person who was well known for being a genius, and his genius was related to, as some people would say, his one part of the brain was larger than the other parts of the brain, and larger significantly than the average human being. So was that structure really related to how he is a smart person? That's an interesting question to look at. And they actually have a piece of that brain, and or actually they have Einstein's brain, and they're still studying it. So when I noticed this, I went ahead and asked myself, why would someone's brain make him a different, more substantial person in history? I have the same kidney as most people. I have the same liver as most people, but the brain is different because it depends on the development of the person. The connections between neurons, the development in some structures of the brain develop differently depending on a person's social area, his parents, his lifestyle, his friends, his interests. So why is this structure more significant than any other structure in the body? Why is it so unique? That's the first question that started to come up to my brain, and that makes me more interested in neurosciences and neurology in specific. So when growing up hearing about neurology, you hear that some common knowledge is and takes 21 days to form a new habit. Well, it's not really that that's not really how a new habit forms. It's actually a beautiful structure of the frontal cortex communicating with the striatum, communicating with the substantia nigra, finally using dopamine. So the brain likes to conserve energy. So if it's something that you consistently do, instead of it giving you energy to do it again and again, it would put it into a circuit. This circuit is formed by the substantia nigra and the striatum, forming it into limbic system for a memory. So this memory of you doing the same aspects again and again, utilizing dopamine as a reward to continually do it, is a way of the brain conserving energy and creating formulating a memory that would become an unconscious engine, let's say, to this habit. Another thing is memory stored as files in the brain, and we just retrieve them whenever we need them. And you can see that in cartoons when someone wants to retrieve a very old lost memory, he would jump into his brain and open a bunch of files. But again, that's not really what happens. Memory is stored as a bunch of pieces. So if you want to remember someone's face, a neuron that remembers the eyes would communicate with another neuron that remembers the nose, and another neuron that remembers the color of the face, and then they would all communicate together, formulating the face. So memory is even more complex than we think, is a bunch of pieces, and the interconnections are what makes an image formulate. So this is my why. In order to answer your why, if you have a why for neurology, allow me to tell you that the brain allows us to love, allows us to write poetry. It allows us to have artistic expression. It allows us to be kind, advance sciences, and most importantly, change the world. This is the most complex, yet the most beautiful organ in the system. And then people would ask me, but I'm going to a specialty that does nothing to the patient. It's a specialty that is depressing. It's the one with the poor prognosis. It's the one with nothing really to do for the patient. Well, let me just show you some recent advancements when it comes to neurology. So this is a advancement in 2018, where it showed that schizophrenia has a link with complement system, and catching this complement system activity early on would allow you to target it and then stop the neurodegeneration that occurs, ultimately leading to schizophrenia. In 2018, when I also showed this presentation, I mentioned how CSF vasopressin was a biomarker for autism. And now in 2021, there's a new research that showed that it utilized that biomarker and replaced CSF vasopressin, which was low in rat subjects, and showed that whenever you replace it, you improve the social defect and allow the person to, let's say, come out of the autistic features that they have. So that's an implication of a biomarker. And then 2-3 years later, it was developed as an implication for management. When it comes to Alzheimer's, we're looking at people in 2017, like Bill Gates, who was a huge philanthropist, investing more and more money into Alzheimer's disease. 30 million investment in 2017. And if you actually look at what he's doing, he invested even more money. So more money into advancing the sciences of the most crucial and difficult diseases would eventually accelerate the knowledge process that we're having. And we also have another very rich person, Jeff Bezos, who in 2019 also joined the race by giving $20 million to diagnostic accelerator projects. And Parkinson's disease, which is a disease we know that has a continuous neurodegeneration, allowing the patient to become more and more disabled in life. And we only can give them medications to slow down the progression and try to focus on slowing the movement issues that they have. We actually have a new breakthrough, and which is a ProSavin. It's a lentiviral vector gene therapy for Parkinson's disease. It's an advancement being used currently in France, where they inject this lentiviral vector, and it's a gene therapy where they inject the putamen and allows the person to function normally by allowing the putamen to secrete, or the brain structure to secrete, enough dopamine, masking the previous lost dopamine need for the brain. And in a 5-year follow-up, it shows significant success. So this allows the patient to only take an injection once in their life, and then for the next 5 years, live properly without a need for continuous injections, continuous oral medication, and continuous device interventions. If we look at multiple sclerosis, we have a clear link between the EBV virus and multiple sclerosis. But how are we going to go towards a eradication of this disease? Multiple sclerosis is a very significant disease worldwide. It affects a big number of young females who are in childbearing age. And it's also associated with significant disability. So it's a disease that needs to be stopped. And in 2022, January, which is this month, Moderna started its first trial for a EBV vaccine. If we eradicate the EBV virus initially from people from a young age, we would generally theoretically eliminate and eradicate multiple sclerosis. So I would bet that most of you who are interested in neurology, whenever you reach your residency or end of your residency, multiple sclerosis might soon be a thing of the past. And then we have this Alzheimer's disease, mentioning accelerating of the diseases with good funding. We have this new medication, aducanumab, which is the first drug to actually target the underlying biology of the disease. Usually we would give anticholinergic medications to slow down the progression of the neurodegeneration. However, this medication is a new medication which is cleaning the amyloid plaques. It's not allowing Alzheimer's to develop on its own. And this is something very, very important because this is the first time we're actually targeting a different yet effective target for Alzheimer's, which is eliminating the plaques before it causes the neurodegeneration. A red flag here is that this is not an endorsement for this medication. There's a lot of controversy with this medication, and it's not me saying that this medication is a solution for Alzheimer's. However, it's going into uncharted areas. In stroke, I want you to forget completely about what we've been doing in the past about imaging the brain and imaging the vessel. We're going directly to the source. The new way of catching a stroke is imaging the clot directly. So what we're going to do is we're going to actually be more specific and find more strokes and be more active in catching the acute strokes. So with that in mind, let me go back and tell you about working as a clinician. So my answer to, but I'm going into a very, very depressing speciality that has nothing to do. Well, and nowhere in medicine do you actually have a cure. So in pneumonia, you're treating a pneumonia case, and then it would mostly come back 4, 5, 6 times per year or per lifetime. Heart failure, whenever you have heart failure, you're actually just stabilizing the heart as much as you can and slowing the deterioration until eventually you'd need to do some drastic measures. Renal injury as well, whenever the kidney is injured, it's injured for life. SLE, which is a very disabling disease from an autoimmune perspective, continues to eat up the person's life slowly. Cancer is something we're still trying to catch. Trauma, whenever you have a trauma, there's no returning back. So nowhere in medicine do you actually have a cure. Everywhere in medicine, there is a very tough fight that we have to fight against pathology. Liver cirrhosis as well. So if you think about it, when it comes to neurological diseases, when you have a patient that's coming with a stroke, he's actually having a disability of his life, and you're able to save him and then push him forward to improve where he is in life and regain the ability to walk, regain the ability to actually go back to his lifestyle. Migraine as well is the most disabling headache in the world. And whenever you treat the migraine, you allow him to become more active in society. Epilepsy, autoimmune diseases, movement disorders, demyelinating diseases, neurodegenerative diseases, all of these things are causing significant disability into the patient's life. However, if you catch it early, if you give it the management, you're able to go back and give the patient an enjoyable quality of life without actually regaining much disease. So neurology is a beautiful uncharted land with so much opportunity and potential. Neurology is also sophisticated, and it needed technological advancements that we have today. So that's why soon you're going to hear so much advancements that it's going to make you forget all the history of neurology, and we're going into a new era with a lot of work. So here is an article that shows a breakthrough in neurotechnology where we're actually able to use fourth industrial revolution concepts and linking the brain, the human, and the technology together and giving the person with a spinal cord injury the ability to walk again. Two of the top 2 medical innovations in 2019 are related to neurology in Cleveland Clinic's most yearly top 10 medical innovations conference. We have also a new gene that we understood recently, and this is the most important part that is always indicated in neurological disorders. Knowing this further would allow us to even target our disease better. And now today, even in my on-calls, whenever I have a stroke, I'm using artificial intelligence. So whenever a stroke code is activated in my hospital, I get all the images, all the analytics about the stroke in my phone, and I'm able to make a decision using artificial intelligence and save the patient's life in an orderly manner. And then we have the human connectome, which is basically the brain you visualized on the computer, and we are able to play with the brain as much as we want and understand what different pathways would lead to different characteristics of the brain. So knowing all this makes us understand that neurology, since it's based on patterns, then we have a big part of introducing artificial intelligence, big data, machine learning, and wearables. And that's where the future is headed. Neurology is very exciting, and you have a chance to leave your mark, as I just explained, heavily. So now, after giving you a big understanding about what's happening with neurology, how can you contribute, what's the beauty about this complex organ, let's talk about what neurology is. So neurology is for the people who enjoy research, who are detail-oriented, because you're looking for very delicate aspects of how the brain function changes over time. Critical thinkers, because it's a puzzle that needs to be understood very deeply to understand how you can save the patient's life. You need to be empathic and love patient interaction, because you're dealing with patients who have a strong disability secondary to disease. You need to be working with technologies and tools, as I said previously. And then finally, you need to put 10 times the effort in a case, because usually early neurological disorders are very hard to crack. If you put 10 times the efforts, you're going to catch it early on, and you're going to save a lot of quality of life about the patient. Neurology and the challenges that we have, it's a rapidly expanding body of neuroscience information. Every 2 years, we have a new disease, new management, new functionality. So we always need to keep in mind that we need to continuously read. You need to have sound clinical judgment, because the decisions you make in neurology are very critical. You need to have communication skills, again, because of disability allows you to have a difficulty with communication and comprehending with the patient. You need to be compassionate because about the disabilities again, and you need to appreciate medical ethics. So the neurology residency is a very complex, or it's a very, let's say, a wonderful experience where you go through different aspects. And it's a 5-year residency program that is split between inpatients, service, consultation, clinics, and taking a taste of other specialties such as pediatrics, neurophysiology, radiology, neurooptha, neuropathology, and psychiatry. When it comes to the breakdown of rotations, you start your first year in internal medicine, where you have a mix of internal medicine rotations that intersect with your neurology practice. And I'll explain it further. Second year, you mainly focus on building a strong neurology base, and also get a touch of other sub-neurology rotations. And this is a good way to focus on your part exam, which is mostly about neurology basics. Third year, you're mainly focusing on supplementing your neurology base. So you're going to go into more complex discussions about stroke cases, neuroimmunology cases, movement cases. And in year 4 and 5, you're mainly focusing on becoming a senior, where you need to have effective management, leadership skills, and you're going to take a bigger responsibility in taking care of the management plan for the patient. So when I mentioned internal medicine, you're focusing on mostly ICU, infectious diseases, endocrine, emergency medicine, cardiology, and rheumatology, because most of these internal medicine rotations, they intersect with neurology. So for rheumatology, you're going to see a lot of SLEs, which is affected, which has a rheumatological implications. Cardiology, you have the AFibs and the cardiac disease that would ultimately lead to strokes. Emergency medicine for the neurology emergencies, infectious disease for the CNS infections, and ICU care for the different ICU needed critical care episodes of neurological disorders. Year 2, you're mostly in basic neurology aspects of the floor coverage, the consultation services, and then touch upon the radiology, psychiatry, and neurosurgery as a secondary rotation. On year 3, you're mostly covering, again, a more advanced look about your neurology basics. And also at the same time, we have in our in KFSH, we have a KSMC coverage, King Saud Medical City, where we cover over the weekend on calls. We go directly as residents in King Saud Medical City, where we rotate with them to cover their clinics, cover their ERs for different calls. This allows us to see a bigger population and allows us to treat more patients. At the same time, year 4 and 5, we go into more specific rotations. That allows us, again, to become more focused on senior level work. And overview of the program, we have, again, a morning report every Sunday. We have a half day, which is an academic teaching. And then we have the grand rounds, which is a very specific topic, usually given by a high level consultant. This is the most recent one, where we invited a neuroradiologist consultant from Mayo Clinic, and we discussed a very important new update on carotid artery evaluation. We also have speciality-oriented rounds. So every day we have a neurology, on Sunday we have a neurology round, which is resident-led, and we look at interesting cases and we review the basics. On Monday, we have neuroimmunology rounds, which is a consultant-led basics, where we look at challenging cases. On Tuesday, we have movement rounds where, again, we look at challenging cases, and neurovascular rounds on Wednesday. So in King Faisal Specialist Hospital, it's targeted to be or ranked first in the Arab world. It's also a pillar of the ambitious 2030 vision for healthcare reform. And most recently, we developed into an independent, not-for-profit foundation, which leads the way to joining the race to be the top of the world, focusing on working with or becoming better than Cleveland Clinic, Mayo Clinic, and those big names as you always hear. This is the overview of the program that we have, as I mentioned previously. And these are the workflows. So you have a daily routine where you come in early, you work on your tasks, look at the stability of the patients. And usually our rounds are midday. We have clinics at the end of the day, and we try as much as possible to cover the patients on the floor's needs. The environment here in King Faisal is an innovative floor. It gives us area for research. It's an area of excellence. So our center, Neurosciences Center, is a center of excellence.
Doctor? Doctor, we are unable to hear you.
Assalamu alaikum. Can you hear me now?
Yes, doctor, we can hear you.
Okay, so again, I'll end with this point, which is you need to be an active contributor to society. We want to see you as a backbone, having a backbone of neurology. So we want to see you in our meetings. We want to work with you in research. We want to work with you in our clinics, so we understand that you have a good backbone of neurology. We also want to make sure that you're active in research, or willing to do research at least, because we do a lot of research here in KFSH. And most importantly, we want you to be competent, so we can trust you with the patients and with the care. And we also want you to have a good attitude and character, so we can socialize and work with you as a colleague. Golden years are very important. The golden months, which is the end of the year, around October to December, January, that's where there's a heavy load and we can work with you more heavily. Try to get recommendations from our consultants, because that would show that you fit our institute, and also be a competent learner, do conferences, and do research. This is the best way to work on. So this is an old number. The communicable score was 80% in my year, and 50 people, actually the second year, 50 people were accepted. In my year, 25, but I think the numbers are increasing. So you have a bigger opportunity. And this time, put your efforts in SMLE, because the most important thing that would get you into the residency, and then everything else is what gets you into the interview. I'll skip this part because this is also a PowerPoint for preparing your interviews in CV. I can share it with you later on in the future. But at the end, I would just say that the brain is wider than the sky. You have a beautiful opportunity to contribute to the science. And at the end, good luck to everyone, work hard, and whatever support you would need. I'm ready, and I'm always ready to take your questions.
Thank you so much for the talk, Doctor. It was really good. Doctor, could you go back to one of the previous slides, because I think we missed another one too. We couldn't hear you a little earlier.
Which one?
The one, I think, which you started.
I think it was the fellowship slide.
The fellowships?
Yeah.
Okay, so here I was just showing that we have big number of fellowships. I tried to put as much as I know about, but I'm sure that there's even more. So you have different fellowships. You have the general fellowships of epilepsy, stroke, movement, and such, but you also have specific fellowships such as neurogenetics, which is a big field coming up, neurocritical care, neuroendocrinology, neuro-oncology, neuro-ophthalmology, headaches, autonomic disorders, interventional, and the list goes on and on. And it's also very important to take that into account, because we have a small number of neurologists here in Saudi Arabia, which brings you the idea that when going into neurology has bigger opportunities for you in the future. If you go into specialized neurology, then we have an even smaller amount of people. So it makes you think that if I go, and we recently had the first headache specialist in Saudi Arabia, which shows you that you can pick one of these fellowships and become the first and most significant person here in Saudi Arabia in that field, because again, there's a very, very limited number of specialized neurologists here in Saudi Arabia. And here is just a slide about supplementing your knowledge with the academies that we have worldwide as well as locally. And this is the slide again for the, what are we looking for in a residence? Would you like me to discuss anything else or answer some questions?
Guys, does anyone have any questions for the doctor? I think that's it, doctor.
Okay, thank you very much, everyone. You have my contacts here. I'm ready to answer any questions later on. And thank you again for the opportunity.
Thank you, doctor. Someone is saying, is asking about الشهور الاختيارية.
Okay, أنا switch للغة العربية ده من السؤال العربي. That's okay. I'll try to answer it both in Arabic and English. الشهور الاختيارية أنا ما أعرف بالضبط إيش قصدك، فلو تشرح لي زيادة عنها. بس إذا قصدك عن متى تختارها كإنترن، متى تطلع الشهور الاختيارية، فأفضل زي ما قلت لك على نهاية السنة حول أكتوبر، نوفمبر، ديسمبر وجانوري. هذه بتكون الأشهر المناسبة، وبيكون عندك ظهور أكثر من الأشهر الثانية، لأن في عدد كبير من الشغل في هالفترة. Again, the most important golden months, what's the best time to put your residence internship for neurology? The best time would be October, November, December, and January. That's if you want to target the best month, then target these months, because we have bigger workload, and that would allow us to work with you even more and see you even more. Other months are fine. الشهور الثانية مناسبة، ما فيها مشكلة. أنت بس حاول تجتهد في الشهر اللي أنت موجود فيه. ما يحتاج إنه يعني تحاول تشتغل على شهر معين إذا ما حصلت لك الفرصة. So if you don't get these months, try to as much as possible to work as well as you can in your respective months. It's not necessary to work on in working in these golden months. If you do any month and you are an exceptional person, we'll remember you forever. كم عدد المرشحين للتخصص؟ كم عدد المقبولين العام الماضي؟ So how many people were accepted? How many people were accepted initially, and how many people were accepted at the end? So I don't remember the number, but I'm sure that now it's above 80, because each institute is accepting more and more neurology residents, and we have more places that are opening up neurology residencies. So I would say about 80 would be the good number of how many people were accepted this year and the coming year as well.
Thanks again, Doctor, for the talk. It was really beneficial. We truly value your experience and guidance.